Hello and welcome. My name is Kaya. I am the Senior Community Programming Associate at the New York Immigration Coalition, and I will be your host. The NYIC has put together a series of videos to connect immigrant New Yorkers to city services that support families' economic, educational, and social development. Today, we will be going over the NYIC's resources on healthcare access for immigrant New Yorkers. We will be discussing the NYIC's Welcome to Healthcare Options for Immigrant New Yorkers guide, and one-pager on Medicaid and Child Health Plus. The NYIC's Welcome to Healthcare guide can tell you about your healthcare rights and healthcare options for immigrant New Yorkers. The guide is available in English and Spanish and can be accessed on the NYIC website at nyic.me/welcome-to-healthcare. In New York, you have the right to emergency care, help paying medical bills, free help finding out what healthcare coverage you qualify for, affordable healthcare at public hospitals, and free professional language interpretation services and translation of important healthcare forms. It is safe for you to access health services no matter what your immigration status is, and healthcare providers won't report you to ICE, USCIS, or other law enforcement officials. A New York State healthcare navigator can help you figure out your health insurance options, which include Medicaid. It is safe for you to use Medicaid, and having Medicaid will not make it harder to get a green card. It is important that you get health insurance if you can. In the U.S., it is more affordable and easier to go to the doctor if you have health insurance. With health insurance, if you get sick or have an accident, health insurance will pay most of the medical costs, so you won't end up owing a lot of money. The Affordable Care Act, also called Obamacare, says that all American citizens and many immigrants have to have health insurance. If you can't afford health insurance or don't qualify for it, you do not have to use the emergency room for regular health care. You can go to a public hospital or community health center. These are cheaper options where you'll pay on a sliding scale depending on how much money you make. They provide affordable health care to all New Yorkers, no matter what their immigration or insurance status is. In New York City, go to a community health center or an NYC Health and Hospitals facility and ask for the HHC Options program. These facilities are New York City's system of public hospitals and health centers. Find one at nychealthandhospitals.org. In New York State, go to a public hospital or community health center in your area. If you get a hospital bill you can't afford, ask the hospital for help from a program called Charity Care. Charity Care is a program that requires all hospitals in New York State to help all low-income people pay for their medical care, no matter what their immigration status is. This could still be much more expensive than getting care at a public hospital. In order to find out what healthcare programs you may qualify for, walk through this chart. First, find your immigration status. This includes lawfully present, non-immigrant, pro-col but not lawfully present, and undocumented. Which healthcare program you're eligible for depends on your immigration status. Follow the chart to learn more about the programs you may be eligible for. These include qualified health plans, which is insurance that the government might help you pay for. You can only apply on the New York State of Health Marketplace during open enrollment, which is a set time period every year. The Essential Plan, which is a low-cost health insurance plan for people who make too much money to qualify for Medicaid. You can apply at any time. Medicaid, which is a health insurance for low-income people that is paid for by the government. You can apply at any time. Emergency Medicaid, which is a program for low-income people who aren't eligible for Medicaid because of their immigration status. You can pre-apply for emergency Medicaid at any time so that the emergency room knows you have it when you need to get emergency care. This only covers the costs of emergencies. If you are pregnant or looking for health care for a child, all children under 19 years old and pregnant women can get health insurance, no matter what their immigration status is. If you're undocumented, you can apply for Child Health Plus. This is a health insurance program for children under 19 years old that the government helps pay for. All pregnant women can apply for Medicaid regardless of their immigration status. This is health insurance for low and middle income children and pregnant women that the government helps pay for. How much you pay depends on how much you make, but this program will cover most of your health care costs. Your baby is covered until they are 1 year old, and after that, they qualify for Child Health Plus or Medicaid. You have the right to get treated if you have an emergency, regardless of your immigration status, insurance status, or ability to pay. You can apply for all of these options on the New York State of Health Marketplace at nystateofhealth.ny.gov or by calling 1-855-355-5777. The Marketplace is the only place where you can get financial help with insurance. If you need help, contact a healthcare navigator. They can give you free help that you can trust. Find a navigator by calling 1-855-355-5777. If you need more help finding healthcare or applying for health insurance, you can visit a healthcare navigator who is trained to help you understand and access your healthcare options. Visit nystateofhealth.ny.gov or call 1-855-355-5777 to connect with a healthcare navigator. You can also ask for help at a hospital or clinic. They have counselors who can help you apply for insurance. To learn more about Medicaid and Child Health Plus, visit nyic.me/childhealthplus. The NYIC's Medicaid and Child Health Plus postpartum coverage one-pager is available on our website in English, Spanish, French, Chinese, Arabic, Bengali, Burmese, Creole, Karen, Korean, Nepali, Russian, Somali, and Yoruba. As of March 1st, 2023, pregnant women and low-income children who are enrolled in either Medicaid and/or Child Health Plus will now be eligible to receive up to 12 months of postpartum coverage regardless of immigration status or how the pregnancy ended. This means that Medicaid and/or Child Health Plus postpartum coverage will now be extended for 12 months after pregnancy, regardless of any change to a person's income or household size during the period that could deem them ineligible to receive these benefits. Services that Medicaid and/or Child Health Plus will cover for the 12-month period include the entire spectrum of Medicaid and/or Child Health Plus benefits, ranging from doctor's visits to hospital visits, prescription drugs, as well as everything in between. Individuals eligible for this benefit include all individuals who, while pregnant, were eligible and received services under New York State's Medicaid program or New York State's Child Health Plus program. As of the 2024 state budget, this benefit will also be extended to individuals in the Essential Plan. Individuals shall remain eligible throughout the duration of the pregnancy, including any period of retroactive eligibility, even if the pregnancy is terminated, and the 12-month postpartum period. Enrollment in Medicaid and/or Child Health Plus can be done at any time during the year. You can apply online at nystateofhealth.ny.gov or by calling the New York State of Health Customer Service Center at 1-855-355-5777 and get free enrollment assistance from a navigator in person or by the phone. To find a navigator, visit info.nystateofhealth.ny.gov/ipanavigatorsitelocations. To find multilingual information about health coverage, visit info.nystateofhealth.ny.gov/InformationalMaterials. Thank you for tuning in, and we hope that this was helpful. To stay involved with the New York Immigration Coalition, follow us on Facebook, Instagram, Twitter, and YouTube. If you have any questions, you can email us at events@nyic.org. Stay safe and take care.